A growing outbreak of Legionnaires' disease in Harlem, New York City has claimed the lives of 2 people and infected at least 58 others, according to officials from the New York City Health Department. The cluster first emerged around July 25th, when 22 residents initially fell ill and 1 person died. Since then, case counts have more than doubled, prompting urgent public health response across the area. Testing revealed elevated levels of Legionella pneumophila in 11 cooling towers within the affected area, all of which have since undergone remediation under mandates issued by the Health Department. Acting Health Commissioner Dr. Michelle Morse and Deputy Chief Medical Officer Dr. Tony Eyssallenne emphasized that building owners detected with positive results were required to initiate corrective measures within 24 hours. Legionnaires' disease is a serious form of pneumonia caused by the Legionella bacterium. It is not spread person to person, but can be contracted by inhaling contaminated mist from sources like cooling towers, hot tubs, decorative fountains, and complex plumbing systems in large buildings. Typical symptoms, emerging 2 to 10 days after exposure, include fever, cough, chills, muscle aches, shortness of breath, and sometimes diarrhea or confusion. Severe progression can lead to septic shock, respiratory failure, or death, especially in vulnerable groups such as adults age 50+, smokers, and those with weakened immune or lung conditions. Diagnosis generally involves a urinary antigen test, sputum culture, or chest X-ray, with antibiotics such as levofloxacin or azithromycin, forming the standard course of treatment. Weathering the rapid spread, city health authorities have advised anyone who has lived or worked in the impacted zip code since late July and is experiencing flu-like symptoms to seek medical care immediately. This advisory specifically targets high-risk individuals to ensure early detection and antibiotic intervention. Although full details of the 2 fatalities have not yet been released, officials reiterated that early diagnosis dramatically improves outcomes, and the disease remains treatable. Even life-threatening cases can be managed if intervention is timely. New York City mandates registration and inspection of cooling towers, a measure intended to limit Legionnaires' outbreaks. In this case, all towers operated within the affected area were tested, and positive ones were disinfected shortly after screening. The city continues to monitor conditions closely to prevent further spread. Prevention recommendations from the Centers for Disease Control and Prevention (CDC) include keeping water systems clean, flushing seldom-used faucets, sanitizing showerheads, and maintaining hot water temperatures around 120 degrees Fahrenheit or up to 140 degrees Fahrenheit to sterilize pipes, though higher temps carry a burn risk. Legionnaires' disease is relatively uncommon but serious. About 8,000 to 18,000 hospitalizations occur annually in the U.S., with a fatality rate around 10%, rising significantly among older or immunocompromised patients. New York City has seen prior outbreaks,